people are out there willing to help, wanting to help, it's about how do we access that.
Collecting the voices of the community, having conversations with them, pulling together groups of women to help shape the services.
Last month, Actors One, our local health and care partnership, held its first Women's Health Conference, officially launching its women's health movement for Bradford District and Craven. The event focused on the importance of inclusive, community-driven approaches to addressing health inequalities and improving women's health across the region. Today, we'll hear from Dr Amy Tatham, GP and Clinical Specialty Lead for Women's Health, Natalie Woodley, Partnerships Manager at the Voluntary and Community Sector Alliance, and Masira Hans, Chair of the Women's Health Network for Mind in Bradford, about how the movement aims to create fair healthcare for all women across the district.
So Women's Health Network is a network, it's a collection of mostly women working or living in Bradford with an interest in the health and well-being of women and their families. So we facilitate safe spaces, we facilitate meetings where we gather women that are living or working in Bradford, and we understand from them what are the issues that they're seeing that are affecting the health and well-being of women and their families, and what can they do about it. We also take all the information that people give us in that network to our very lovely commissioners and talk to them about, actually, these are some of the things that we're seeing on the ground.
There's a number of social and cultural barriers that many of our patients face, but also language difficulties and digital exclusion as well. Working with the VCS, the Voluntary and Community Sector Alliance, they have some fantastic connections within the community. They have a great understanding of some of the gaps that we have.
We are the middle ground between the NHS and the voluntary community and social enterprise sector. We hold a lot of funding that we disseminate amongst the grassroots organisations, and we're also the voice for the grassroots organisations. I head up all the women's health projects, in particular the women's health movement, which is a focus on an online hub where there will be lots of resources, videos around women's health, collecting the voices of the community, having conversations with them, pulling together groups of women to help shape the services. The consensus is that there isn't enough time to talk to a GP. You're in there, your appointment's for, well, essentially 10 minutes, but it never feels like 10 minutes. And you're left thinking of, oh, why didn't I ask this? Why didn't I ask that? Having this online hub space would give them the answers and better able to make informed decisions about their own health.
Conference for me is really, really exciting because so many people are coming together in Bradford, having a full day, a full campaign around women's health. It's coming from people on the ground around what are the concerns affecting them and what we can do about it.
The day is split into two, so the morning will be more about professionals and the afternoon will be a community element. And I will be running a workshop, there'll be panel discussions.
What we're hoping is that we manage to get a fantastic crowd of people all in one room, from clinicians, from primary care, secondary care, from the community clinic, and also people from the voluntary and community sector to talk about the future and where the gaps are and to generate ideas on how we can fill those gaps.
What I really hope to get from the Women's Health Conference is just that shared conversation, that shared space, that understanding, but also building the networks and understanding that some of the women's concerns, they're across the board. You know, regardless of socioeconomic factors, ethnicity, all of those kind of things. There's things that connect us, that are similar to us, and we can get support from one another.
The conference will ignite a flame and get, people excited about the whole movement and starting to do some work in the community. And long term, the hope is that, the website's well used, that people are contributing to it, that there's much more around women's health and that women are advocating for themselves and that they're able to make informed decisions.